am performing hand hygiene. Okay, I'm now going to verify the provider's orders with MAR. I'm going to now say that I see no discrepancies between the provider's orders and MAR. Okay, I'm now going to ask my patient. Alright, do you have any allergies or anything that could contradict you to be able to receive the medication that I will give you and that was ordered? Okay, great. If he had anything, I would check the MIR. I'm now going to ask for your name. Okay, I'm going to compare his name with the MAR and the medication. Okay, I'm now going to grab the medication. I'm going to be using pain reliever. It's like ibuprofen. Anyway, I'm going to make sure that the medication label is the right dose, the right drug, that it's going in the mouth, and it's at the right time. And this is stated that you should take it after eating, so it's right about time, right after dinner. So my patient just got done eating dinner. It is the right dose. You should be getting about 220 milligrams. So he needs pain medication, and this is a tablet, so you should be taking this by the mouth. And I'm not going to open the medication. Okay, moving on. I'm not going to provide privacy for this patient by closing the curtain. I'm going to perform hand hygiene. Okay, can you please tell me your name and date of birth? Okay, great. I'm now going to ask the patient if he has any allergies. Do you have any allergies? Okay, you don't have any allergies. Do you have anything that could contradict your the pain medication that I will be giving you today? Okay, great. So the reason that you will be receiving this medication is because you have said that you are in pain. You said from a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain you ever felt, you are feeling like a 4 pain. So we're giving you pain medication to stop the pain. With this drug, it could cause some kidney problems, liver problems, but these are all some issues that are not likely. It could also cause stomach bleeding, but we will keep an eye out. If you do end up having allergic reaction, it is possible that you will have swelling and hives and could go into shock. But like I said, we will keep an eye out for that. So, do I have your consent to give you some pain medication? Okay, great. He gives me consent. Do you have any questions for me before I begin? No. Okay. The patient says that he doesn't have any questions for me. So I am now going to perform a physical assessment on the patient that includes vital signs. I'm going to assess the patient's ability to swallow by asking him to swallow. Can you please swallow for me? Wow, swallowed great. Okay, so the patient can swallow. I'm now going to make sure again that the medication is the same on the MRA. I'm checking the dosage, and it is 220 milligrams. The name is naproxen sodium. It is a tablet, which means it's going by the mouth. You should be taking this after you have something to eat, and in this case, it's right after dinner, so perfect timing. And it is the right patient. Can you please tell me your name and date of birth again? Okay, great. This is Tammy. Tammy Susami. That's her name, and that's what it says on the bottle. Okay. I'm now going to inspect the site. If I was doing an IV, I would be checking in the forearm area where you would have it there. But since this is oral medication, not a subcutaneous medication. I'll be checking the mouth, checking for any lesions, trauma, inflammation, or bony prominences. Or if, let's say it was a shot, like let's say you had strep and you needed an injection, you would locate the subcutaneous tissue and you would stick it there about 1 inch from the umbilicus. Sorry. I would cleanse the site with an antimicrobial wipe in a circular motion, and I would work outward 2 inches. I would grab, I don't have anything, I guess I'll use this. Okay. My patient took his drugs. He could swallow. So now I will grab, I would have already cleaned the surface. I would have my clean gloves on. I would allow the skin to dry. I would also uncap the needle. I am now going to grab the subcutaneous tissue with my non-dominant hand. I don't know what to do. Here we go. Okay, and I'm going to grab with my non-dominant hand. I'm going to squeeze, and I'm going to take the needle and I'm going to put it at a 45 to 90 degree angle. And I'm going to stabilize the syringe and put it inside the skin, and I'm going to slowly inject the medication. After doing so, I'm going to remove the needle and remove the subcutaneous tissue that I'm squeezing. I'm going to apply a cotton ball or gauze to where I just put the shot in with my non-dominant hand, and then after that I'm going to have the person probably hold it while I put the tip on the needle and discard that into the sharps container. After doing this, I'm going to inspect the injection site for any redness, swelling, bleeding, or any type of reaction that could indicate an allergic reaction or anything such as that. I'm now going to, I would apply a bandage either over the cotton ball, or I would remove the cotton ball if it wasn't as bad. So I'm now going to remove my gloves and dispose into the garbage can. I'm going to perform hand hygiene. I'm going to elevate the patient's head to a minimum of 30 degrees. I'm going to place the oral medication in an appropriate container for administration. I'm just gonna put it in this. Okay, and I'm going to tell the patient to take the pill and then to swallow. Great, okay, now swallow with some water. Great, okay, the patient has swallowed the medication. I'm now going to perform hand hygiene. I'm going to put the bed in the lowest position. I'm going to make sure the bed is locked, the side rails are up, the call light is within reach, and I'm going to perform hand hygiene again. All right, thank you. Bye.